everyone, this is Island Nurse and welcome back to my YouTube channel. Now in this video, we're going to be going over how to answer priority questions on the NCLEX. So we go through some of the strategies that we use and then we would actually answer an NCLEX question together. Now, one of the first strategies that we use for answering priority questions is the ABCs. So we would attend to the patient's airway, then their breathing, and then circulation in that order. The patient is in cardiopulmonary arrest, the order is reversed, so it would be CAB, which stands for compressions, airway, and breathing. Another strategy that we use is Maslow's hierarchy of needs. And of course, you know, according to Maslow, we have to meet physiologic needs before we move on to higher order needs. So we meet physiologic needs, then safety and security, then we move on to love and belonging, self-esteem, and finally self-actualization. Also, we want to use the strategy of stable versus unstable. So when we are looking at the patients and assessing and determining which patient we need to assess first, we have to ask ourselves, is the patient stable or unstable? And we'll know that the patient is unstable if we see the condition deteriorating, if we see the vital signs begin to deteriorate from the baseline. And in a situation where all of our patients are stable, we want to firstly assess or attend to the patient who is at risk for complications. So the patient who is most at risk for complications, that's the patient we would attend to first. Next, we want to look at acute versus chronic. So a patient with an acute problem would be a priority over a patient with a chronic problem. We also want to pay close attention to the nursing process, assessment, diagnosis, planning, implementation, and evaluation. And we always have to remember that we need to assess the patient before we do any implementation, before we do an intervention. Also, this is very important. We want to look at expected versus unexpected outcomes. So if we have a scenario and we see certain signs and symptoms, we want to ask ourselves, based on the patient's diagnosis, are these symptoms expected, right? Are these normal symptoms? So we'll want to pay attention or attend to a patient who has unexpected outcomes before we attend to the patient with expected outcomes. We also want to pay close attention to safety. Remember, the NCLEX exam is testing your ability to perform safely as a nurse or your ability to provide safe nursing care to your patients. So when we consider safety, we look at reducing hazards in the environment that can cause injury to the patient. We also want to pay attention to decreasing the transmission of pathogens. And also we want to respond appropriately and in a timely manner to patients experiencing allergic reactions or adverse reactions to medications or treatment. And finally, we want to prioritize activities that are very time sensitive. So for instance, we know that we have to give insulin before a patient has a meal, so we have to be very mindful of that. We want to pay attention to meds that we have to give, stat doses of meds, and also if we have to prepare patients for procedures, like the patient has to go to the operating room or the patient may have to go for a stat x-ray or a CT scan, we want to ensure that we prepare the patient in a timely manner. So let's go ahead and look at our priority question and see if we can use some of the strategies we just spoke about in order to answer this question. Let's read. An RN is about to make first rounds after receiving an intershift report. Which patient should the nurse assess first? So we know that this is a priority question because we see the word first. So the nurse has just started her shift. She has received a report on all of these patients and she's trying to determine which patient should be a priority, which patient should she attend to first. So let's look at our options now and we'll examine each one. So option A says, a patient with a tracheostomy on a mechanical ventilator who needs sterile sputum sent to the lab. So the patient has a tracheostomy or a surgical incision made in the trachea to give direct access to the breathing tube. We know that the patient is not breathing on his own because he has a mechanical ventilator, and we need to collect some specimen from the patient. Now, at first glance, you might think that this patient is the one who is most in need or who is most unstable. However, there is nothing in the statement here that says that the patient's condition is deteriorating or that he's unstable. And the need that the patient has at the moment is to have sputum collected. And collecting a specimen is not a priority. So I would not see this patient first. Let's move down to number 2. A patient who arrived 30 minutes ago from the post-anesthesia care unit. So I know that this patient had surgery because the patient was in the PACU and they've just arrived on the unit a mere 30 minutes ago. So this patient would be a priority for me because I know that I would have to be assessing the vitals. I have to pay attention to level of consciousness, assessing the patient's oxygenation, looking at their urinary output and their wound sites. And patients that have just arrived from surgery or just arrived from the PACU are patients that we give high priority to because they are at risk for developing complications from surgery or from the anesthesia. So I would definitely put a check here as giving this patient priority over the patient with a tracheostomy. But again, we have to read down and look at all of the options. And next, we have a patient on rifampin whose urine has an orange-red discoloration. Now, is this something to be alarmed about? No, it's not, because we know that rifampin is a drug that is used to treat tuberculosis, and one of the major side effects of that drug is that it changes your urine and other body fluids like tears to an orange-red color. So this would not be something that would alarm the nurse. So therefore, this patient is not going to take priority over a patient that has just returned from the post-anesthesia care unit. And as a nurse, one of your responsibilities is to educate your patients. And of course, every time you're administering medication, you have to inform the patient of the side effects. So you would inform this patient that this is normal and nothing to be alarmed about. And finally, we have a patient with pneumonia with an oxygen saturation of 96%. So the patient does have a respiratory condition, yes, he has pneumonia, but if you notice, the oxygen saturation rate is within the normal range. Normal oxygen saturation is from 95 to 100%. And so there is nothing about this patient's condition that suggests that the patient is unstable because we have the oxygen sat within the normal range. So the answer to this question would be option B. The nurse would firstly assess the patient who arrived 30 minutes ago from the post-anesthesia care unit, and that is because this patient is at the greatest risk for developing complications. And in all of the other options, we do not have any indication that the patient is unstable or that the patient's condition is deteriorating. So I hope that you have found this useful, especially those of you that are preparing for your NCLEX exams. If you found this video informative, don't forget to like and subscribe, and feel free to leave your comments in the comment section down below. Thanks for watching and see you next time.